Hello everyone, Dr. Jason West, and I'm excited to talk to you about autoimmune problems because I really challenge the idea that one day your body decide to attack you. Now that's possible and happens in some of the cases, but not nearly as often as medically they portray it to be. So let's specifically talk about what your immune system does, which it helps for repair and defense of the body. So if you sprain your ankle and you injure some tissues, the body sends some immune system cells to basically eat up and clean up the damaged cells and allow the body to put in new cells. That's one part of your immune system. It also protects you from bad guys, bacteria, viruses, fungus. And if you get too much inflammation in the body, it can cause a host of problems, psoriatic arthritis, rheumatoid arthritis, multiple sclerosis, ankylosing spondylitis, Sjogren's disease. Well, that's just some of them. There's a whole host of them. But I really think at the root of the problem is actually some infectious disease. And I see really, really good outcomes when you help the immune system work correctly versus having the immune system killed or destroyed with some type of prescriptive medication or TNF inhibitor or something like that. So what happens when people have MS? I'm just going to talk about that. There's 5 causes in my world of MS, or my thoughts on MS. The first one is you can have a genetic component from your mom and from your dad, and it's not always associated with genes, but you always want to know, is there a history of MS in your family? Because if then you're fighting against Mother Nature, and it's not the most difficult thing to treat, but it's not easy either. The second part of MS is, are you getting enough fats to protect the nerves, and are you absorbing the fats? The third one, which I think is the most common one, is infectious disease. Do you have some type of microorganism, a Lyme disease, a bacteria, a mycoplasma, or some type of viral infection around the nerve? And as the body comes in to try and take care of that infection, you create an inflammatory response, the body tries to wall it off, and now you have the white lesion or the interruption in the nerve supply. On the flip side of that, with joint problems like rheumatoid arthritis, again, out of control inflammatory system. But why? Is it the body attacking itself, or do you have some type of infection in the joints? And my argument to that is there's an infection in there. The body doesn't have quite enough juice or mojo to get rid of it. It sets up a chronic inflammatory system. And as the body's trying to get rid of it, it has accidental damage to the joint structures. So in the medical world, most of the time they want to decrease or remove the inflammation by killing a part of the inflammatory response or the immune system. And if there is an infection there, this is why I see so many people that don't get better on that pathway. We can maintain it, but for the most part, it's a life-shortening therapy. We're going to knock out your immune system, and then you can't defend yourself, and some other type of opportunistic infection comes in. So what I think you need to do with MS or RA is upregulate the immune system. You want to identify, do you think it's a bacteria? Do you think it's a virus? You can do that with some blood tests. You can do that with a research application with some medical microscopy. But you want to identify is another thing that's very common to see is a parasitic involvement, and you want to help the immune system to get rid of the bad guys. My personal goal when we see people come in with autoimmune is you want to give them as much IV vitamin C as possible. You want to upregulate the immune system, and I see really good outcomes. And if it was a true immune system, autoimmune system problem, and you gave something to upregulate the immune system, it would make the patient a lot worse. And in my experience, it actually makes people better. So there's an infectious disease component associated with autoimmune, and you want to reduce the inflammation, but you want to reduce it naturally. You want to get rid of the sugars. There's a great book called Peace of Mind that was written by one of my patients named Jenny Carr. It talks about how to get rid of all the inflammation through eliminating the 56 names for sugar. It talks about your water intake. It talks about peace of mind, how to center yourself. And so when people have this autoimmune diagnosis, again, Sjogren's disease, ankylosing spondylitis, multiple sclerosis, rheumatoid arthritis, you want to put everything back in balance and harmony. You want to help with relationships as much as you can. You want to make sure that the hormones are balanced. You want to treat the biochemistry markers, make sure that the blood tests are normal. You want to treat any blood test findings. You want to treat any biomechanical lesions, and you want to help the immune system to work better. Some of the best treatments for that, major autohemotherapy, DMSO therapy, IV vitamin C therapy, and neural therapy, getting the nerves to reset for those chronic conditions. I think there's a lot of hope for people that have this diagnosis. There's a lot of testimonials. on our channel of people that were diagnosed with a quote autoimmune unquote, and then we upregulated their immune system and they got their life back.
Hey, thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, like, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.